Fine.
I'll start recording. Okay.
Okay.
So,
I will start for timer now.
yeah, you can start the 3 minutes for reading.
Okay, fine.
Good evening, Dr. Ahmed. Welcome.
Okay, we can start.
Okay, we'll start. 5 minutes. I want to put a timer so everyone can hear the timer because we were practicing earlier, but we don't know the time. So this time we really want to hear the time.
Okay, I will send the
Okay. Okay. Let's start, Dr. Nem.
Okay. Good afternoon. I'm Dr. Niam. I'm the attending physician today. May I have your name, please?
My name is Asha Rana.
Okay, and how may I address you?
You can call me Asha, Doc.
Okay, thank you. Well, how can I help you today?
Well, you see, Doctor, this morning I was giving presentation to my colleagues. Then suddenly I felt weak on my right side, this my arm, right arm. And then after some time, my friends told me that my speech was very slurred for about 5 minutes. So they told me to see a doctor. That's why I'm a bit worried, Doctor. What happened to me? Why I started slurring?
Oh, I'm sorry to hear that from you, but are you worried?
Yes, I'm worried why it happened suddenly.
Okay, can I ask you further questions, then I can help you?
Yeah, sure.
Well, you are saying just for 5 minutes you have developed this, not more longer, yes?
Yes, that's correct, Doctor.
And any previous attacks like this?
No, I don't remember having this before, Doctor.
And did you have any dizzy or headache or loss of conscious
No, never felt that.
or twitching around the mouth? Any other symptoms you remember that you didn't mention?
No, other than that, because sometimes I drink a lot, so I have slurred speech. But other than that, I don't think so. I have any other like that before.
Okay, so sorry for this. And another thing, I want to ask you, do you have any high blood pressure or anything before?
No, Doctor, I don't have any other episode of that. So that's why I came for checkup.
Okay, so now from my examination, and now I'm auscultation and from your heart rate, blood pressure, and respiration. And I think this is maybe related to the heart or blood vessel. But we have to do further investigations. Do you ever heard about any blood or did you have any blood investigation before?
No, I haven't done. So I need to do some tests, you mean?
Yeah, that's right. We will do full blood examination, including thyroid function tests, okay, a blood sugar, blood cholesterol, urine electrolyte, and creatinine clearance. This will give us further picture of your thyroid function, and for your kidney, for your blood sugar, and also for fat in your body. And this may be a predisposing factor for your condition. Is it fine for you?
No, I'm a bit worried, doctor. Why this all test? Why do you need full blood examination, thyroid? What is it to? What is the connection with my condition? Why?
Because
I'm more worried now.
yeah, I understand that. It's understandable, but I think there is a condition known as transient ischemic attack that affects your brain due to loss of a blood supply for transient time in your brain, and this may be due to these predisposing factor I that just mentioned for you. That's why we are going to do this blood investigation. Is it clear for you?
Yes. So are you saying that I might had a mild stroke?
Yeah, that's right. That's what I'm suspicious of that, and we have also to do another test, an ECG and CT scan. Did you hear about this investigation? Do you need uh, an
Yes.
explanation? Yeah.
Yeah. What is it? CT scan and ECG. I have heard, but I don't know what is it.
Okay, ECG just like a wire connected to your heart that give us some picture of how function of your heart, and also a CT is just like a machine equipment that you will enter through and will give us an extra a radio. It is just like an X-ray, a radiation, but it will not hurt you, not painful, nothing at all, and we just take a few minutes. 5 minutes already elapsed.
So you have to. That's why I think what I found is you got stuck. You forgot. You skipped the city scan earlier, so you have to go fast in the
Mhm.
city. Like, don't wait too much. I'm telling you, you have to make sure you finish everything. I'm speaking slow because I don't. I want to see if you want to, like, you can extract some answer from me because I'm not giving that much.
Do
But
you
you
do you,
have to.
do you
Yes.
think I'm slow or just what's the problem?
I think your problem is you're not going through the line. I'm saying you went to the second, your task, second task, explain, and you didn't went to the third. You should have gone to them. Well, you see, we have to do some blood examination, thyroid, blood test, and cholesterol, urea electrolyte, and also,
We have to
um,
do CT and ECG. That's right.
yes,
Mm.
maybe I have to refer you. And because, and I said, why, doctor? And because if I'm not giving you any hint, you have to jump because it's your test, not mine. I can do whatever, like, but you have to make sure all your what you call all your tasks is done. And I say, yeah, I know you're afraid, but I have to rule transient ischemic attack. That's why I have to do it. So do you have any more question? And like, and I said, so will it come again? Well, we have to wait for that. There is a possible cause, and but we have to wait and see the results. And also we also have to see that it doesn't have any like serious complications. So try not to do stressful work or like that. You have to jump. I mean, it's your task, so you have to complete.
I don't know how to combat this. This is the second or third time we did a test and the same thing. I stuck in something and I didn't finish. And
Yeah,
this is
yeah. Do you have a pen? Do you have a pen or pencil at
yeah,
the
I
site
have
in the note? Okay,
yeah, I
when
have.
you're like, for example, that's why I'm saying that I don't know if they give the pencil during that. They give you the paper to see, right? But you have to keep a mental check, like
Mm,
find the history of the symptom and how long it lasted. That
mhm.
one. Once you finish, you check. Yeah, like, thank you, Dr. Mustafa. You check that one. You don't go up again, go down again. Next, you jump to the blood test. You start doing full blood examination. You start saying and jump to the third. And maybe we also have to refer to CT scan, ECG. Once finished, don't go again, go down. So, and he said, why do I have to do this? Because we're afraid that you might have transient ischemic attack, and we have to rule out. We have to make sure that you don't have this. So you see, there are do you have any question for me? Because it says answer his or her question, then you're at the last. Now you can finish. Make
Then
sure Yeah, you are stuck in the third line. I mean, the refer. I was waiting for you to go to the. That means you are not reading. You have to read. I saw that many times.
No, I read it. The only thing when I said, for example, a CT and ECG, I read it, but I couldn't. I didn't know. I don't know why I didn't continue to say CT and ECG. I just jumped. Yes, maybe this is TIA and need CT and ECG. Do you know what CT and shall I say? Do you know what CT or ECG, or it just I will mention
First,
and if you.
yeah, what I suggest is make sure if you have a lot of time, because I think you were it can be done in 5 minutes, but you have to make sure, because did you see in the last they say answer his or her question, then you can ask, do you know what is CT scan? After you finish your task, only you ask.
Okay, fine.
Just to be on safe side, you have to be very very quick. That's why I was speaking very slowly, because I want you to read and go through everything line by line. Don't miss anything.
I read it, and for some reason I don't know what it is really. I didn't say it. I read it and I
Maybe
knew.
practice. Maybe we need to practice again. Don't worry, we'll do it again. Same thing. Okay, Dr. Ahmed, can we? I don't know who's Dr.
Okay.
Mustafa. Can we time it again? 5 minutes.
I actually time it. So if anybody can time it for me.
Yeah, sure. Anyone time.
The line before the last line, he said, explain to the patient without alarming him or her that transient ischemic attack must be ruled. What does he mean by without alarming?
Because we don't want to scare the patient. Because the main thing is what I have ischemic attack. What do you mean by that? You mean I have mild stroke? Because he may be scared. So that's why I said we have to do CTs. I think we may have to refer you to CT scan or ECG. And the patient say, why do you need that? Because you may lose time when you are separating, because we come to the creatinine clearance up to, and we may have to refer you for CT scan and ECG also. So you already complete the 3, and the patient say, why? What are these? What are these so many tests? Why do I need this one now? CT scan, you say blood test. Well, now you can together you can say, because we are afraid that you may have what you call transient ischemic attack. So, and he may say, what? I have a mild stroke? You mean? Yes, but not sure. But we have to make sure it's not the one. That's why we are doing so many tests. So the patient may ask you anything. That's the thing. But your English should be good enough to answer whatever. Sometimes I may ask, what is CT scan? What is ECG? So before he asks, or the patient asks, what is blood test? What is thyroid function? You complete all in one, so save time, and refer you to CT scan. Learn to, your task is to make good rapport with the patient. You have to show you are building good relationship with the patient. Also, you have to show you are very good in English. That's the 2 things we have to show.
Okay. Just now I realized that it is just saving time to take it in one shot.
Yes, that's
right. CT and ECG, and then you reply why TIA,
yes.
and then if you want to ask, you will say what is CT and ECG.
That's correct.
Rather than I ask and then use it.
Don't ask.
Yeah, this will save time. That's why. Yeah.
Always keep it in the end. Keep it in the end. Try. What you have to focus is make sure you finish all your tasks. The bullet, the 1, 2, 3, 4. Come to the end. Then you can ask again, or then you can summarize. Okay, just to make you clear. You have any question, you can ask me again, and I can recap for you again, like that.
Yeah, just I realized this. Thank you for this comment. Thank you.
Okay, let's do this one again, one more time.
Yeah, okay, thank you. Okay, shall we start now?
Yeah, time it. You have to make it in.
I will make it, or anybody? I will type first. Just
I will make it. Okay, start.
Okay. Good afternoon, I'm Dr. Niam. I'm the attending physician today. May I have your name, please?
I'm Asha Rana.
Okay, and how may I address you?
You can call me Asha, Dr. Niam.
Thank you. So how can I help you today?
Well, Dr. Niam, the problem you see is that Yes, today I was giving this, presentation to my colleague, and suddenly I felt some weak on my right side, and
Mm.
especially my arms. And I felt that my friends were telling me that my speech was also very much slurred for about 5 minutes. So they told me that I have to see a doctor. So that's why I'm a bit scared, doctor. What is it? Why did I start slurring, and why do I have pain on my arms?
Oh, I'm sorry to hear that from you. Are you worried?
Yes, actually, I am worried, and also my job is very stressful. That's why.
Mm-hmm. Okay, so can I ask you another question? Any other symptoms that you feel, just like headache or loss of conscience or dizzy?
No, no, doctor, I don't feel that.
So there is nothing apart from this.
No.
Well, so from my examination and auscultation and including also heart rate and carotid auscultation, I feel it is we have to go through blood investigation, further blood investigation.
Why do I have to do investigation? Why?
Because we are just suspicious of something known as transient ischemic attack, which is stroke actually. And
hmm
so we have to go for full blood examination, including thyroid function tests, blood glucose, cholesterol, urea electrolyte, creatinine clearance. And also we have to go further for CT scan and ECG.
Wow, that's a lots of tests. I'm worried, doctor. Why I have to do such like so you mean to say I have a mild stroke?
Yeah, that's right, because I already mentioned that this may be a stroke. We are not sure. That's why we are going to do blood investigation and further CT and ECG so we can reach the possible diagnosis. This is maybe one of the causes or maybe related to stress or any other thing. Is that clear for you?
Yes, but how about future? Will I have another stroke in future also?
Well, we cannot give you a clue, but it is manageable and preventable. Once we reach the diagnosis, we can treat it so we can prevent further stroke. It could happen, but however, we can manage.
How about like what should I do so that it doesn't become very serious and it doesn't happen again? How can I prevent that?
We can go through two lines with manage your lifestyle, just like if you are a smoker or taking alcohol, or we can manage this, and we can manage your body weight or exercise. This is one line, and the other line we can give you some medical treatment that lower your cholesterol if it is high. So both of them can cooperate with each other, so it lower the possibility of second attack.
So you mean to say if I control my drinking habit or smoking habit, and if I take medicine, then it may have less chance of having. Is that correct, doctor?
Yeah, that's right. That's right.
Thank you
So,
for letting me know.
so this is clear for you. Any other question you can ask me?
Yes, what is this ECG and CT scan, doctor? I've heard, but I'm not sure. What is
Well,
it?
Well, ECG is just a wire connected to your heart and give us some picture of your heart function. And CT is just an equipment. It's just like a radiation, X-ray radiation. You enter through and it will finish and give us some picture of your brain, because we are suspicious of that transient ischemic, that stroke. Is that clear for you?
Yes, but how about this urea and electrolytes, creatine? What are these for? What do
Because
they measure?
Yeah, because this measure your kidney function. Sometimes if kidney function is not well, it just reflects the possibility of stroke.
Time.
Yeah,
So scared. Sorry, I
okay.
got so scared in the middle.
Yeah,
Okay, but I think it's good. Now you already managed to control, right?
yeah. But still, if that person of that
Mm-hmm.
continue to ask me and I didn't do a review or just like summary, is it okay?
Yeah, without even asking, you have to summarize. Since you didn't summarize, so I started asking to fill the gaps. So
Okay. So
you're
no,
supposed to summarize.
no. I was about to summarize, but I told you is that do you have any further question? Then you said what is CT, what is ECG, what but that's
Yeah,
why I.
yeah, yes, I asked, but okay, after I asked something, you jumped. So let me summarize it for you and make it easy for you. You can ask and do your,
Okay.
no matter what I say, you have to complete your task. Introduction is how you introduce, right? The second is you build rapport and finish your task. Building rapport means your relationship with the patient has to be very comfortable, and the ending is conclusion. So so let me summarize what we've dealt with today, or what we talk about, like that.
Okay,
So
fine.
I can say whatever because I'm the examiner. So but you have to complete your task. You have to ask question if I'm not speaking, and you have to summarize and complete your
So I
task.
can
Yes.
interrupt you. So I can interrupt you. If even if you want to ask, I will tell you. So let us first summarize and then.
Oh yes, yes. Not interrupt what I say. Like for example, what is this? Oh, why don't I recap? That will be better rather than, because I'm asking, because you're not recapping. So I'm asking, what is this creatine? What is CT scan? What is cholesterol? Because I didn't understand. So okay, when I ask doctor, what is creatine clearance? And you say, oh, well, let me summarize everything for you. So I can make it everything clear for you. You can say that and explain everything. I'm giving you a clue rather than I say, what is CT scan and ECG? You said, okay, this is CT scan. Rather than saying that, what you can say is like, how about me explain each and every, all the summary, or let me summarize everything for you so you don't have any question. That will be, and also when you were giving me the suggestion of your, you can you please use the word lifestyle modification?
Yeah, that's right. Yeah.
Because you were saying, I'll give you one line, two lines, so I did not understand, and that's not the correct English. They may not understand. So I wanted to ask, what is what one line, two lines? So say, I suggest you can do lifestyle. You memorize this word. I suggest you to have do some lifestyle modification. You can write it down, and you can have you control your, and also since how about you, when you're asking question history, make sure you always ask about your work, because there is a stressful work. Sometimes they say, are you because you ask, when did you start, when did you have pain, and how about your job? Always ask, how's your job history, work history. It may be related too much, and that's why you can say in the end, maybe you have to lessen your stress. Don't stress too much at work, try to relax. That's also a suggestion.
Okay, fine.
So we have to know every detail. Let's move on to the next.
Okay, thank you.
When is your exam? 11th, right?
Yeah, just 3 days.
Dr. Ahmed, is it okay we do one more with Dr. Niam, and after that Dr. Ahmed and Dr.
Yes,
Mustafa? Dr.
I
Mustafa,
recommend
is it
this
okay?
from last time.
Thank you. Thank you. I remember.
Okay.
Thank you.
Dr. Mustafa, I'm sorry, you are also waiting. I hope you don't mind.
So long time I wanted to do this speaking lessons, but then nobody there in that group to reply.
Sorry about that. Okay, let's practice one more time. No worries. Okay, timer again.
Okay.
Yeah, okay, thank you. Now I will start, or this is the same?
Yeah, 3 minutes.
3 minutes, I will start, okay.
Shall we start?
Yeah, okay, fine.
Okay.
Okay. Timer?
Okay, you took less than 2 minutes. Okay.
Sorry. Okay, fine. I will start. Timer?
Okay, start.
Okay.
Okay, start.
Good evening. I'm Dr. Niam. I'm the examining doctor today. May I have your name, please?
Good evening, Dr. Niam. I am Asha Rana.
Can I or how may I address you?
You can call me Asha.
Okay, and how can I help you today?
Well, doctor, I was because I was told that I have this large lump at the back of my at the back, and I was told that it has to be it has to be removed, and I'm afraid that it is a cancer, but my doctor told me that it's not, and they told me that the surgeon was asking me to sign for the procedure, but I wanted to see a doctor, and so I'm just worried. Can you explain to me if the lump is cancerous or not? And how will the surgeon will know if it's not cancer? I feel it may be a cancer.
Well, I'm sorry to hear that from you. It's understandable that you are worried about, but from my just now I'm revising your file. I feel there is the risk of cancer is just extremely low. That because the lump will be from my examination also. And the lump it will be examined under the microscope and the patient and you will normally get the result within 2 weeks and in the clinic, and this will also be checked then.
So, but I have been told to come back in the outpatient clinic after 2 weeks. I don't know why the result is taking so long. And how will you know for sure that what you've taken out is not cancerous? Can you assure me, doctor?
Yeah, of course, I can assure you because from the appearance of before and still there is in your file written things, and that the scar I can feel it is just like it will take 2 weeks. It is this is normal thing, and the because it is just like they take histopathology exam, and the area, the wound will be healed within just like 1 month, and you can take care of this, keep it area dressed with the stair step, and the stair step will minimize the size of that of this scar. Is that clear for you?
Yes, doctor. Okay, I'm worried about the scar on my back. Like, how can you minimize the scar? I'm afraid there will be a scar if I remove the lipoma.
Yeah, I just mentioned that this scar can be minimized by stair step that we will put, and also this is by time it will shrinkage by size, and don't worry about this. And still this because if it is a lipoma, it is unlikely to recur. So don't worry about all of this. Is that clear for you?
Yes, but I am just worried. Like, what if it grows? Like, for example, you say it may not occur in that same place. What about it occurs in another place? And what if the surgeon doesn't remove it all? at all and leave something there? I'm so worried.
Well, the removal of the lump is unlikely to recur in the same area if it is removed all, but sometimes if not removed, can recur, but very rarely. And don't worry, we can remove it a second time. But let me explain that very rarely happen. And we have also to follow up with you. Don't worry. Is that okay for you?
Yes, I think I understand a little bit, doctor. Thank you.
Okay, so let me summarize this. You have come today, you are asking about the lump that
I
already
Fine,
okay,
fine.
okay.
So
okay,
you
continue.
still no, I want to, Dr. Nam, I think you are you still have to increase the speed and reading and the saying, because you are taking too much time in the second and the third line, paragraph of what you say. I want you
Actually,
to be very, you have,
I didn't understand how it come. It is it is
mhm.
removed in the before in the hospital, and then she's coming and she doesn't understand, and uh, something something not well understand my for this.
Because if you don't understand clearly, how will you explain to the patient? That's the problem. Okay,
Yeah,
so
that's why. Mm.
that's why we are given 3 minutes time to understand. For
No, I
example,
didn't. I even if the 3 minute, I didn't understand it well because I'm just now. I'm just looking. She was talking. She was coming for 2 week already booked for the clinic and coming
mhm.
for histopathology under microscope. At the patient get the result within 2 weeks, and then the wound is to be checked. Okay, I said it, but when you're asking if it is, we want to
Mhm.
how we can be sure it is only lipoma, not cancerous. How can I take it? How can I assure you?
We'll do we'll do examination, microscopic examination.
I
That's why
told, I
yeah,
told.
yeah, you have to say again, because you have to make sure the patient is like convinced. You have to, like, that's what I'm gonna act like, the building rapport. That means I understand, as I said before,
Okay.
because the patient is very anxious, and
Mm.
it's first time the patient is hearing, so the patient may not know anything. So you have to say, as I mentioned before, as I told you before, like that.
Okay.
So,
Because I
so
say, but I don't know. It's still slow. Maybe I'm slow. Maybe
yeah, a
something.
bit slow. You have to jump from the second to the third line a bit fast. Don't just, that's why I say read it. Don't try to make it too much. Like, if you're not confident, then because I realize when you start explaining, you add your own thing and it doesn't sound very clear English. So I'm just afraid, stick to the line here. For example, if I explain, well, the lump will be examined under the microscope and the patient will, like, you can get the result within 2 weeks, and also the wound will be checked, and then I'll say something, but you have to, whatever I say, try to like, mix it, go to the third line, don't jump to the second. Even if I say, like, why it's 2 weeks, and I say, oh, that's the regular time you need, to check on the microscope. And of course there will be scars, yes, what about the scars, I may ask, because the patient can ask anyway, but you have to listen and don't say that, oh, I already said, and why she's still asking. You cannot say that. What if the patient did not hear what you were saying? That's why I'm asking. I said,
Mm.
why are you taking, so maybe you said microscope, but I didn't understand why, what. That's why I'm asking, why it's 2 weeks. As I mentioned before, because we have to check it in microscope, go take it to the lab. That's why. And how can you be sure? As I mentioned again, that it has to, we can check it in microscope and make it sure.
Well, I think that the thing that the time over because you were afraid if another time appear and in other
Mhm.
place, this is not written.
Yeah, and if I'm saying that, make it very short. Don't explain too long. 1 or 2 sentence. Can we do that? Like, what I feel that maybe you're sometimes I've realized when you start explaining, you forget, right? That you have to, like, it's time limited. I've noticed that when you explain, you may like lose track of the time that you have to finish. Because for example, I say, I'm afraid of scar. You said, yes, there will be scar, and it will fade with time, and we can dress it in stairs. And I said, what about the scar? I said it right again. Yes, I mentioned that before. Like, we will be dressed, and make it very short. If I'm asking for first time, make it long, but if I'm asking again, make it very short.
And that's
So
why the time is over, because in the second time I started again and again the same way. That's why.
yes. And why would the patient ask again and again? Because he did not understand the first time what you were saying.
Why? You
Because
mean you mean
yes,
I wasn't clear with you?
yeah, a
Or
little bit. Yeah. Because you were explaining to me this and that, but I couldn't follow completely. That's why I said, what about this one?
no, see, I wanted to be just more clear, because this is my time. Unless it is only 2 to 3 days, I will exam. You said the lump. I told you that it was histopathology and it's something like this. And then again, you asked. I told you. I replied already. As I mentioned, it is histopathology. It will take this time. And then I jump right to the other side, and there will be a scar, and we will dress by stair step, and that's why I just mentioned. And then you asked me again for the scar, so
Yes.
it's clear for that. How it come?
Yeah. If I do that, just say, as I mentioned before, that just
Yes.
make it fast, 1 or 2 line. Don't go from the beginning. Just as I mentioned before, just we will dress it with the star stripe. So in a month you'll be okay. Just make it a short line, because there are chances that the patient may ask like this. That's why I'm saying, if this happens, as I always say, as I mentioned before, you'll be given look at it, look at the line, and just use a few strips and move to the next jump. Okay.
Okay, fine.
Okay.
Okay.
So Dr. Ahmed is praying, you mean to say?
Go
Dr.
on
Ahmed is praying. Dr. Mustafa is in clinic. Are you free? Okay.
Okay, I'm okay.
No,
Yeah.
I'm saying, I'll just ask Dr. Mustafa, you want to do now, or so that Dr. Niam will, or Dr. Mustafa, are you with us?
Nobody there.
No, okay, we'll just move on. Yeah, if Dr. Mustafa and Dr. Ahmed, you are back, just let us know. Oh, where? Oh, Dr. Mustafa is also praying. Okay, Dr. Niam, we'll move on to the next. Let's save time.
Okay, so this is the hospital, so I have to ask you about your ID, yes?
Yes.
About your, check
If
your,
not, rather ID, or I've noticed that sometimes the ID date of birth is also okay, I think.
yes, I will ask of the name and date of birth, and
Yeah,
then
that will be fine. So
uh,
Dr. Niam, sometimes
yeah,
I'll be very like reluctant if I say, what is this again and again? You just mentioned, as I mentioned before, and skip to and say shortly, you will do this and go to the next line. Save your time and summarize. So you have to be
oh,
very smart, very smart. Don't say, but I said like that. Don't think like that. Just be smart. Use your
okay,
brain and say, like, I already mentioned, as I mentioned before, you did, and let's move to the next. Bring me to the next, and I'll summarize. Don't worry, I'll summarize once again for you, like that.
okay,
Do your thing.
okay. Can you just maximize the screen once more, just a little bit?
Small.
Maximize the size more. Now it is small, yeah, now it is fine, yeah,
Yeah,
and
you can see.
just make it the lower down, because I want to see the whole for me.
I don't know why it's like.
Now
I
it is
don't.
big, but it appear only first for line.
Oh, okay, I got it.
Now,
I don't know.
yeah, now okay, yeah,
Now
okay.
it's okay.
Just
Okay.
the last line is appear, the
Oh,
last
okay.
The
This one
last
is
two,
longer.
yeah, okay, diet and soft what? I don't know what I written.
Can you see, can you read it? Soft
The,
stool consistency.
no, this line is disappear now.
Really?
Yeah.
I can see it.
Yeah, now it's okay. Now, okay, fine. We will start to read. Okay, 3 minutes.
Yeah,
Start.
time it, please.
Now the please please the last line is not appear for me. Last line is not appear. No.
It's
Now yes.
big.
Yeah. Now okay. No.
I don't know. Mine is clear.
Okay, fine. That's the only thing. Fiber diet and soft. Okay, stool consistency.
Soft stool
Yeah.
consistency.
Now okay, fine. Start.
Okay.
Doctor, now another time it is just the line reassure the patient she is doing everything possible and the other thing not appear. Now appearing a little bit, just higher up, please.
I don't know why. What's my screen is okay though.
Now it is maximum. Yeah, now it's fine. Don't move it. That's it.
But I cannot see mine. That's why.
So that's why you minimize it and make it for both of us so we can see clearly before they are coming from their prayer.
Let me try use the other one. I don't know why whenever I use this one it becomes smaller. Let me try the other one, okay? The other one, okay. It's supposed to be bigger.
Okay, fine. And now I can see explain the need to avoid constipation and maintain high fiber diet and only soft what? I don't know. Soft what? Soft drink?
Soft stool.
Stool. Okay, that's it. And I need, although it is small, but yeah, now the fine. Now fine.
I'm trying to use the other one if it's like, where are we? Because this one, yeah, we done this. This one, is it clear now?
Yeah, the same before. It's okay, fine. We will start. This is
okay.
We will start. Okay.
Okay. Shall we start?
I'm just reading. I'm reading.
Oh, okay. Oh, okay. This one is hospital, so you have to ask my date of birth, I think.
Yeah. Well, we can start. Fine.
Yeah.
Okay. Good afternoon. I'm Dr. Niam. I'm the attending physician for today. May I have your name and age, please?
I'm Asha Rana. I am 29 years old.
Okay, and how may I address you?
You can call me Asha.
Okay, thank you. How can I help you today?
Well, doctor, you see, I've been admitted in a hospital. So Doctor, since I'm admitted in hospital, you see, I've been I've been admitted in hospital because they say I have diverticulitis. And I don't know, like doctor think that it will be okay, I'll be okay in 1 week and they will give me some antibiotic, but I'm just afraid that what if I have bowel cancer and they're hiding or something. So I just want to make sure that, do you really think I have diverticulitis? Because I've never heard of this word. What is this diverticulitis? Can you explain, please, doctor?
Well, I'm sorry to hear that from you, and I can reassure you, it's understandable that you are worried. Don't worry. We have first to confirm because you want to assure how you can be confirmed. We need to do CT scan to confirm the diagnosis. And first, let me tell you what is diverticulitis. It's just like diverticuli, just like a pocket in the inside the intestine, that or tummy, and it will get inflamed if you have constipation, and this will cause some problem for you, maybe pain or any other symptom, and we can just confirm it by CT scan. Is that clear for you?
Yes, doctor, thank you very much.
Okay,
I'm just,
let me
yes,
ask you another question. Do you have any family history for
yes,
this for bowel cancer?
yes, my mother died of bowel cancer at 55 years old.
Sorry for this, but let me tell you, we have to take this as it is simple diverticulitis, which will be benign. It is not cancerous, but can change to cancerous later. So we can just follow up you. And we can do further investigation if we need it. But now we can just we have to make your diet more soft, to be aware of sign of symptom, if anything change in your habit, bowel habit, or any blood in stool, and we have to go through regular checkup. And as I told you, we can do even colonoscope, which is later, not now, to be done. Is it clear for you?
Yes, doctor. So you mean to say that if I follow what you have told me, then I can prevent having same bowel cancer like my mother. Is that correct?
Yeah, that's right. And as I mentioned, we can do also colonoscope. Is that okay for you?
Yes. So you mean I have to follow a good diet and have
High fiber. Yeah.
yeah, high fiber diet and do checkup and colonoscopy, right, doctor?
Yeah, that's right. So let me summarize for you. This is to confirm the diverticulitis. We have to do CT scan, and we talked what it is and how we can prevent it. We can also do follow up for colonoscope to check for further symptoms. Is that okay for you?
Yes, doctor, that's okay for me.
Any question you want to ask me?
Oh, well, I just what do you mean by good diet? You mean high fiber diet, doc?
Yeah, high fiber diet. Just you have to avoid constipation, and to drink a lot of water. Take vegetables and fruits. Be aware not to take that constipating food like a lot of bread or dairy products. This will cause you constipation. Is that okay?
Yes, doctor. Thank you very much for your explanation.
Thank you. Bye.
Okay. What's the time, doc?
I'm sorry, I didn't make. This is the only thing that I don't know how long it took.
But I think it was okay. So Dr. Mustafa is not here yet, I think. We'll go with Dr. Ahmad.
Okay. I
Dr.
think it
Mustafa,
was within time. I think.
yes, yeah, I think so.
Mm.
Because you were able to summarize. But don't go, Dr. Niam. You'll be after Dr. Ahmad. We will keep on practicing until we
Okay, fine.
keep on listening. And if you find something, then you can.
Okay,
Okay,
thanks.
Dr. Ahmad, are you ready?
Yes, okay.
Let's move on to that. Please time it.
It is card number 6, June 14.
Yes, yes, that's correct.
I will time
Is
for
it
you. It's okay.
okay? Thank you, Dr. Niam.
Yeah, we'll start to read it now. Start.
Yes, yeah.
Okay.
Shall we start?
Still there is time. Okay, fine. Just 30 minutes, 30 seconds. Fine. You can start. And I will time for
Time
you.
it.
Start. Yeah, start.
Dr. Ahmed?
Okay, good evening. I'm Dr. Ahmed Ali, the treating physician today. I think I have seen you last week. Could you remind me with your name?
Yes, Dr. Ahmed, I am Asha Rana.
How may I address you?
You can call me Asha.
Hello, Asha. Nice to meet you again. So, what can I do to you today?
Well, Dr. Ahmed, do you remember last time I had to, like, I wasn't feeling well and I was like, I had difficulty sleeping at night and I felt a bit stressed. So I came to see doctor last week and I was told to do some blood tests. So I'm here to see my results for the blood test.
Okay, let me check your notes and the result.
Thank you.
Okay, I see from the notes that the examination last time you were normal and the lab results are well. So I can reassure you there is no medical issues that make you worry.
Oh, okay. So you mean to doctor, you mean to say that I don't have any major problem, is it?
Yes, there is no major problem. I think this is from stress and thinking about the exam and poor sleeping. So I advise you to do some gentle exercise and avoid stimulants like coffee and sugary foods and
Yes,
try to
but
relax. Is it okay with
yes,
you?
yes, but why I was feeling so tired,
Yes, this is because overthinking about the exam and the result and trying to study for a long time without sleeping for enough time. This all makes you tired. But actually, there is no medical issue. Your examination are normal and your lab results are normal. So try to stick to what I told you about avoidance of overthinking about the exam. Try to relax. Try to use less coffee and try to sleep at regular time in a comfortable area. So all of what will help you and you will do better.
Yes, thank you, doctor,
Is
for
it okay
understanding.
with you?
Yes, doctor, but the thing is that my exam is coming in 2 weeks and I need a medical certificate for my exam. So, doctor, can you please give me a medical certificate saying that I'm not feeling well or something? Can you please write me a medical certificate saying that I'm not feeling well, please, doctor?
I'm really sorry. I can do this for you now because up till now you are normal and no medical issue that I can give you a certificate. So try to take my advice and if you need further, I will prescribe to you. Is it clear for you, Asha?
Yes, but doctor, you should feel sorry for me because look, I'm so anxious because of my exam, and if you don't write me any certificate, then I'll fail, or you know, it will affect me more. So please, doctor, can you please try to understand my situation and write me a certificate, please?
I understand your worries and concerns, but according to the protocols and your situation, you don't need this medical certificate. You just try to relax and follow my instructions, and you will be better. And you will not need for this. I hope you to do good in the exam and wish you good luck. Is it clear for you?
Okay, if you say so, doctor.
Uh, Okay, I will give you another appointment within 1 week to see you and follow up your situation. Don't worry, you are in a good hand, and you will succeed in this exam. Thank you.
Okay.
In time.
Thank you. Yes, don't talk too much about the like you'll succeed in exam or like that. Just say because I think how you explain is very simple words. Dr. Ahmed, you're using very like what do you call very simple. So try to be. I think your rapport is good because rapport is means your connection with the patient. How you are connecting with the patient. Are you trying to convince? And rapport is good. Dr. Niam's also was good, and yours is also good about. So what you have to do is little bit like don't make it too short sentence like no, you have to do follow me. These sentence should not be there. Just try to make a little longer sentence, and with what you say, little longer sentence, and try to use a little not too simple words. Like I understand your situation, but I'm sorry that you have I cannot give you the medical certificate because I feel that you're completely all right, and seeing from your result as well, try to like add little long sentence, not like oh you're okay, don't drink like this, don't drink coffee like that. You can say how about not drinking too much coffee, and so that you may have better sleep, and try to relax, don't overstress yourself. And do you drink or smoke? You can ask that also. Try to ask more. How do you build the relationship with the patient is you ask more and you learn more things from the patient, and you say it's good that you don't drink or smoke, and that's good for you, but you have to take less stress for your exam, and maybe it will be good for you. Like you can talk anything as long as you can twist and it's within your given task. So far it's good, it's okay. But just little, don't make it too simple, like drink this, don't drink coffee, don't drink. So how about if you don't, instead of saying don't drink coffee, like how about if you don't take too much coffee for studying, maybe this will help you to relax more. You can use this sentence, instead of saying don't drink too much coffee, different way of saying same thing in a better way.
Yes. Okay.
Okay. How about Dr. Mustafa? Are you ready? Hello.
I think Dr. Mustafa can't join us today. He will listen only.
Oh, okay. Then it's okay. Okay, Dr. Niam,
Okay.
let's go.
Yeah.
Dr. Niam one more time, and then Dr. Ahmad, you want to continue?
No. Give the chance to Dr. now.
Yeah,
Thank you.
Dr. Niam.
Yeah.
Dr. Niam, and then again Dr. Ahmad. We'll do. Don't worry, we'll do.
I can join now.
Oh yeah. Okay then. Dr. Mustafa,
I just escaped from patient.
Oh, okay. Dr. Niam, is it okay? I'll
Yeah,
Dr.
of
Mustafa.
course. Yeah, he can take
Don't
his
worry.
time.
Don't worry,
Yeah,
I'll do it forever. Okay,
it's okay.
Dr. Mustafa, let's start this one on the screen.
Okay.
Can anyone time it for us, please? Thank you.
Yeah. Start now, 3 minutes. Read
Okay,
it.
thank you.
السلام عليكم. السلام. I'm sorry for interruption.
Yeah, sure. Let me know if you're ready.
Okay, I'm ready now.
Okay, let's.
Ready?
Okay. Yeah, yes, sir.
Okay, I will time for you just a minute. Now you can start. 5 minutes.
Okay.
Okay. Good afternoon. I'm Dr. Mustafa. I'm the teaching doctor for you today. May I know your name, please?
Hello, Dr. Mustafa. I'm Asha Rana.
Okay. How can I reach you?
Or you can call me Asha.
Okay. Hello, Miss Asha. I know, Miss Asha, you came for me before because you have a stressful job and you asked for sleeping pills, and I give you benzodiazepine. How often you take this sleeping pills, Miss Asha?
Yes, doctor. I've been taking the sleeping pill every night.
Yeah. What about your sleep pattern now?
Now like it's getting better, but I'm running out of the pills, doctor. That's why I have come today. So can you refill my prescription, doctor?
Yeah, Miss Asha, as I said to you before, these sleeping pills will not help improve your sleep for a longer time, and there is a risk of dependency also. So I commend for you some other measures to improve your sleeping habits. Is that okay with you?
Well, I still need to like it helps me to make relax and able to cope up with my work. And doctor, my work is very busy and I need to sleep very well. So I need this pill. So I just want a refill. Is it okay, doctor?
Yeah, but I know this, Miss Asha, but I recommend better for you, better than these pills. I recommend you to try other non-medical interventions, just as regular exercises, and also to control the workload. And also, we can reduce the alcohol and the caffeine use. You do you need me to tell you more about that?
No, doctor. But how will I cope up with the sleeping? I really need to sleep well, doctor, because I travel a lot, as you know how stressful my job is, and I even have to travel overseas on business trip. So, doctor, I really need this pills. Please help me, and I hope you can refill it because I can't cope it without it. I can't cope up without it.
Okay, Miss Asha, I can refill you these bills, but I recommend you better for these non-medical measures, and I recommend you also then when you need to stop these bills, you can't stop it suddenly, so because there is risk of withdrawal symptoms if you withdraw it rapidly. I advise you to gradually withdraw these bills till you get till your body is will get rid of these bills. Is that clear with you?
So, yes, I understand. So yes, I will understand. And I also try to stop the pill once my work is like slows down also. But yeah, I'll try, since I'm so busy, I have to take it. And I'll try to take all the other advice you've given, like exercise.
I consider you other strategies to cope you with your stress, like psychotherapy or like relaxation therapy, like any other therapy to help you, like regular exercise, like to improve your sleep pattern, like to reduce the other caffeine and alcohol use. Is that okay for you?
Well, I have to try that, doctor, because I'm not sure, because so far the pill has been working great for me, and I was hoping that you would give me again, but since you're not giving, so yes, I'll try the other. Thank you very much for your advice, doctor.
Thank you, Ms. Asha. As I said to you, this the long use of these pills will not help you improve your sleeping pattern, but there is risk of dependency. And otherwise, if you stop these pills suddenly, you will get the withdrawal symptoms. So I recommend of you other strategies, like other strategies to cope with your anxiety and regular exercise, and to reduce the caffeine and the use. And also, you can control the workload. Is that okay with you?
Yeah, hopefully, yes. I think so. I can do
Okay,
that.
thank you, Ms. Asha. If any other quiz, don't hesitate to contact me. Thank you.
Thank you very much, Dr. Ahmed. Dr. Mustafa.
Still there is 18 seconds. Fine, very good.
Oh, okay. Yes. Dr. Mustafa, yours is like you need to I think you need to build little bit rapport. Dr. Niam builds Dr. Ahmed builds good rapport. I've noticed, like they, like, you know, Dr. Nam is, oh, yes. Oh, okay. She says that she's listening to me, what I'm saying. So you have to say, you also have to give me some clue, Dr. Mustafa, saying, okay, you cannot say, oh, yes, I understand what you're saying. And did you understand this? No, you cannot say that. You have to really calm down. You have to listen, like saying, Dr. Mustafa, you have to say, yes, yes, I understand. And is that all right with you?
Yeah, I understand, but also I have an anxiety from the workload today.
Oh, I'm sorry to hear that.
The same kind.
So, okay, is that all right? Okay, I think you need to relax more.
I better to take the sleeping pills.
Yes. But you may suffer from withdrawal symptoms, so I advise you to reduce your workload.
Yeah, I will accept this.
Okay, let's move on to Dr. Nian.
Yeah, okay. Yes.
And then we'll go. We have to save time and jump. Okay, let's start.
Who will type for me? Anybody?
Okay, I'll do
Dr. Ahmed.
Okay.
3 minutes.
Okay.
Okay, you can start now.
Okay.
And sorry, I have to tell everyone that you have to make sure you ask lots of questions to the patient. Don't listen to me only. Try to ask, what do you work? What do you do? Please be very, like, you know, inquisitive. You want to know everything about the patient.
May I ask, setting GP mean it is GP clinic?
Yeah, general practice, yes.
Yeah,
GP.
clinic.
Where is it?
A clinic, mini clinic. Yeah. Okay. Okay, we can start. Fine. Okay. Anybody time for me?
Yes.
Okay.
Okay. Well, now, good evening. I'm Dr. Niam.
Yes.
I'm attending physician today. May I have your name, please?
Good evening, Dr. Niam. I'm Asha Rana.
And how may I attend? How may I? Sorry. And how may I address you? I just feel tired.
You can call me Asha.
Okay, thank you. How may I help you today?
Well, doctor, I have some problem with my knees, and I've been having pain in my knees for last few days. And when I run and play sport, because I'm a basketball player, and but I don't remember hurting myself. I don't remember that, banging my knee somewhere. But I've noticed that my knee is making some clicking and popping noise, and sometimes even gets locked. And I have to play this on this weekend. So can you help me? Why the and this pain has been growing for some times. Can you help me?
Oh, I'm sorry to hear that from you. Of course, I can help you, but let me ask you. This is you said during playing you didn't hurt or you didn't nobody hurt you at all.
Well, I did have a sudden pain in front of my left knee during practice, and I had applied a ice pack, and I was driven to the surgery by the coach, and and after that, it had swollen, and it had become very painful when I
Mm-hmm.
started to walk or put on weight.
Mm-hmm.
And so after, I think my pain started growing after that. I just remember.
Okay, so sorry for this. So from my what I've heard from you and of my examination, I'm just suspicious or most professional diagnosis is a meniscus tear. Have you ever heard about this diagnosis or this disease?
Maybe yes. Yes, I think I've heard about it, but the doctor, I want you to fix this because I really need to play in this competition this weekend. So, can you give me some numbing or painkiller or some medicine? Please help
Oh,
me, doctor.
okay.
How can we treat it?
Okay, actually, painkiller will help you, but not much need. You have to do some treatment, just like rest and ice compression, elevation, and I have to refer you to physiotherapist as well, because painkiller alone is not enough, and the physiotherapy will give you some exercise and some special specific treatment regarding maybe cycling or making some physio for you. This will be beneficial. Is that clear for you?
Yeah, but doctor, I really need to play this weekend. I can't afford not to play. I think you are mistaken like me with others. I'm very strong and fit. Just give me painkiller. I'll be okay and all right in no time to play. Please help me and give me the painkiller, please, doctor.
Well, it's understandable that you're worried and you want to go for the play, but it is not allowed. This is not well for you, not good. And just to be sure that you will be healed, you have to have some rest. And with physiotherapy and making just what I mentioned for ice and compression, and this will give you a good healing effect. So far. And is that clear for you, please?
Yes, doctor. So you mean to say I should not play the sport this weekend?
Yeah. Yeah, please, for your health, for your best interest at my heart. So let me summarize for you that you are coming with this pain in your knee that happened since long time because of you are playing, and my suspicious is meniscus tear, and we talked about how to treat it. And we will go through some exercise by physiotherapist, and I recommend not to go for coming play. Is that clear for you?
Yes, doctor. But what happens if I go and play? Will it have long-term effect?
Yeah, of course, you will not be able to use your leg. Maybe
I
this. Yeah, finish.
Okay. Yeah, it's okay. You already summarized, so it's
Yeah,
okay. It's
fine.
good.
Good.
So I
Thank you.
think we've improved. Yeah, we've improved a lot. Let's go, Dr. Emma.
Yeah, thank
Are
you
we
very
ready?
much.
Okay.
No problem.
Okay. About meniscus, I think we should make it more clear. Could we say this is a cartilage between your knee bones? This protect your bones.
Yes,
And
of
there
course.
is a tear, and
Yeah,
we
you
can.
can. But I asked her already. I told her, have you ever heard about this? She said yes. So I didn't elaborate more. That's why.
It's you can say, what you can say is, just to be on the safe side, you say it's called meniscus tear. That is torn cartilage. You have to mention that one. No need to say
Okay.
other. Torn
Okay.
cartilage, because it's given in your paper, so you have to read that.
Okay, fine.
Make sure whatever they give you, you read it.
But
Sometimes
they give
yeah.
me the likely diagnosis is meniscus tear in a way that she will understand. That
Yeah,
I told
meniscus tears, or which is torn cartilage.
torn cartilage. Fine. Okay. I asked you, however, this is
Yeah,
maybe
I didn't, but I think in, like, for example, diverticulitis and others, even before they ask, try to explain to, like, if you know it. If you don't remember, then it's okay, but if you know it, just mention it, so that you don't lose marks. Yeah, safe side, always on the safe side. Just see, that's why in 3 minutes try to see what I have to mention. That's very important.
Okay, fine. Yeah, thank you.
Okay. Yeah, no problem. Okay, Dr. Ahmed, one more time.
Okay, August 14, card number 3.
Yeah, August 2014, yes.
Turnam, you can set the time for us?
Yeah, just a minute. You read it already, so just 5 minutes, yes?
Okay.
Timer. Yeah, you can start.
Okay.
Why you didn't start?
No, we are reading.
Oh, okay, fine.
But I keep on reminding everyone that you have to ask me lots of questions, because I'm giving so much. Sometimes I may not talk or say anything. I just say, oh, I have a headache. Then it's your duty. You have to ask me, what type of headache? When did it come? Everything. If I don't speak.
Mm-hmm.
When it says take history, make sure you ask me everything.
Okay.
Okay, let's start, Dr. Emma.
Okay.
Okay, let's.
Good evening. I'm Dr. Ahmed Ali, the treating physician for you today. May I have your name, please?
Good evening, Dr. Ahmed. I'm Asha Rana.
Okay, how may I address you?
You can call me Asha.
Okay, Asha. How can I help you today?
Well, Dr. Ahmed, I have been having this headache since 3 months, and it's on the left side of my head and in my temple area, and it's so painful and I can't bear it. So I came to ask about, like, what could be the reason, and I'm also scared, what if there is a tumor in my head or something? So, I'm just worried about my headache.
Oh, I am really sorry to hear this. Are you in pain now? Do you in painkiller now?
Yes, I have been taking paracetamol, but it does not relieve my symptoms at all.
Okay, I'm really sorry to hear this. May I ask you a few more questions to rule
Yes.
And figure out what is going?
Yes. Yeah, also to tell you that I have take I've taken medicine containing barbiturate.
Okay. How long time you are taking this barbiturate?
Well, I've been taking for some time, ever since it started, for 3 months, I mean to say.
Okay. About this headache, you feel it in one side of your head or both
Yeah,
sides?
it's on my left side,
Left side.
on the temple area.
Do you feel any other symptoms coming with it, like vomiting or something else?
Well, I do feel like nauseated, and I have to lie down because they cause so much pain.
Okay. Do you hear any abnormal sounds or any abnormal
No, doctor, no, I don't hear
normal vision
anything.
during this?
No, no.
Do you have loose weight?
Oh, not that no, I haven't noticed that.
Okay. What increased this headache?
Well, sometimes when I drink red wine, like, I've noticed that whenever I drink red wine, it comes after that.
Okay, I see. And what relieves it?
Well, not exactly. I've been taking this, I told you, the medicine, the strong, containing barbiturate, that helps me. And sometimes I have to lie down. So that's all I can do so far.
Okay. Any of your family members have this problem?
Yes,
Before?
yes, I have also noticed that my mother, who had died 10 years ago, had similar headache. So I'm just worried about that. What if I also have something like her?
Okay, I understand your worries about this, but let me reassure you. This could be what is called migraine, and this is a benign condition, and it is treatable. Am I clear so far for you?
Yes, you mean to say I just have a migraine. So how can I, like, what can help? How can it be helped? Like,
Yes, what can we do for you? We can refer you to a neurological examination by a neurologist who cares about your nerves. So he can figure out what is the main cause for this, and you can follow up with him, and you will improve. Is it okay with you?
Yes, but doctor, I would like to request the medicine. My mother used to take this a medication, and I think if you give me that type of medicine, I may be all right. Can you give because it worked for her. So can you give me the same medicine that contains barbiturate, that I took?
Yes, barbiturate was used before, but nowadays there is more recent treatment, and if you follow my advice and go to the neurologist, he will give you the most recent and best treatment for this condition. Is it okay with you, Asha?
Yes, I think if you say so, and if it works for me, then I think I'll follow that.
Okay, I can also, for your knowledge, the best treatment for this is prevention. So try to avoid what increases episodes of headache. You can try to drink less wine. Try to relax. Try to be away from noisy places. And it will help you a lot. Is it okay with you?
Yes, doctor. Thank you very much for explaining to me. I'll try to follow your advice.
Okay. Thank you, Asha. Let us summarize what we have said. You, based on your medical history and examination, we suspect that you have a migraine. This is a benign condition, and it is treatable. And we will refer you to a neurologist for further investigations and follow-up. Thank you.
Okay, time's up. Okay, I think we've managed so far, but Dr. Emma, don't pause too much, like I've noticed, right? So I think you just notice. Otherwise, I've noticed you've improved a lot in a sense, like you know what to say, like twist and turn. Just don't pause for too long. Rather, I would advise you to speak slowly. Like if you don't know, speak very slowly like me. So take your time to think. Oh, migraine is not a very serious condition, you do not need to be afraid of it. I know it gives some pain, and also it can be caused by like eating different things. Like in your case, it is red wine. Some people have migraine because of chocolates or coffee or anything. So you need not worry, because many people have different types of migraine, and it can be controlled. And when the migraine comes, there is an aura before it comes. If you know about migraine, you can talk a little about it to fill in the time. There is an aura before the migraine, and you can feel that it is coming. And after you've got migraine, even if you take medicine, it doesn't work. So you have to take before you have to take the medicine before the migraine comes, so it will be effective. So whatever you know about migraine, you can say, because it's very 3 short line I've seen, so that's why. But so far yours is good. And so you said we have we have discussed so far what we have discussed. Let's go through what you can write that word. Sometimes you can say, let's summarize this, or let's go through what we have discussed a while ago. You can say that also.
Okay.
All right.
Anyone knows what is the abortive treatment for migraine?
Abortive treatment is more like, abortive means something that you give up, like don't drink red wine at all, because if that's the one that is causing you can say abortive treatment is like preventive means something you don't drink at all. Abortive is more like, I think, to give up. For example, if you preventive is not to drink what you call, not to drink red wine, because that's preventing. You are preventive. Abortive is in the middle, you can stop it. So what triggers migraine in, and what can, like for example, flashy headlight, like disco light also causes migraine, I think. Something flashy.
Yes.
Yeah, and you stop it. Like if you're in a party or if you're joining something, try not to. If you feel that you are triggered by something like a flashy light, or like in a disco, just keep yourself away from it. That's abortive. Stopping it. That's what I understand. There may be other things, but that's what I understand.
I think abortive, when I have migraine, I will take medication to get rid of this migraine. But preventive, not to get migraine from the start.
Yes, that's what. Because in migraine, you cannot, once you have migraine, even if you take medicine, because remember, migraine comes at the peak, and when there's at the peak, when you take the medicine doesn't work. You have to take it when the aura comes during the migraine. You have to catch during the aura, because once you have a peak of the migraine and you take medicine, it doesn't affect at all.
Yeah, so if I have the aura, I will take medication. It will abort the migraine. But if I now between the attacks, I can take medication to prevent the migraine.
No need. You can even if you take medicine, it won't work. So it has to be. I think abortive is that also. Yeah, abortive can be medicine, and also when like you are dancing in a disco and a flashy light, and if you stop the light or if you prevent, that's also abortive, I think. But
yeah.
What's your specialty, Dr. Asha?
I said my specialty is nothing. I'm specializing in OET.
Yeah. OET. You are surgical or medical or what?
No, I haven't started my specialization. No personal question. Let's go to the next. You want to,
okay.
Dr. Mustafa, you want one more, because I gave how many because it's Dr. Niam's examination, we are focusing more on her. So
okay, I can take one more.
Yeah, Let's become, Dr. Ahmed, you have done 2 or 3, right? 2 or 3.
Total. Okay, and enough for me.
Yeah, so let's do Dr. Mustafa one more.
Okay, I'm ready.
Okay, yes.
This one, hospital emergency department.
Yes, but you have to slow down, Dr. Mustafa. You really have to, you cannot speak this English the same way you speak your, what you call, the way you speak generally. You have to be very, like, calm and very, what you call, like, because Dr. Ahmed, I think he can twist and turn. Dr. Naim, I've noticed that she's very good. Her rapport is very good with the patient. So you have to also develop, like, so oh, I understand. You have to develop that also. You have to say, you cannot say, yes, I understand. Yes, I understand. No, you have to say, oh, okay, slow down. I understand what you're trying to say, and I have my support for that, or something. You have to develop the connection with the patient. That is a little bit missing in yours. Dr. Ahmed and Dr. Niam has a good rapport with the patient. So you have to
Okay.
yours is your understanding is very good, and you know what to say, and you are always on the time, but your rapport you have to develop. Let's practice on that.
Okay, I'll try.
Okay.
Okay, I will set the time for you.
Yes.
Okay, 3 minutes. Start. This is card number 4, August 14.
Okay, I'm ready.
Yes. Okay.
Okay, good afternoon. I'm Dr. Mustafa. I'm the teaching doctor for you today. May I know your name, please?
My name is Asha, Dr. Mustafa.
Okay, Miss Asha. How can I address you, Miss Asha?
You can call me Asha.
Okay, Miss Asha. How can I help you today?
Yes, doctor. I came to visit Australia from UK, and a while ago, about 2 hours ago, my daughter, she's 5 years old, was bitten on the face by a dog, and the dog is my friend's dog, and we are
Oh,
staying
Miss
with
Asha.
her. So I'm so worried about her. Please, can you, like, help me with this?
Oh, Miss Asha, I'm so sorry for that. Must be stressful for you. I need to assure you, Australia is free of rabies, so we have no risk of rabies for after this dog bite. Can you tell me more about the circumstances or how the dog reaches a child?
Well, yes, it's my friend's dog, and we're staying with her, so we're just playing. That's why, and suddenly the dog, attacked my daughter, and so I want to know how you're gonna treat the wound, doctor. I'm just
Yeah,
worried.
yeah. I'm so sorry for that. I need to assure you. But how can you tell me more about what the first aid you did for this after the dog bites the child?
Oh yes, doc. After it bit my daughter, what I did was I took the wound and kept it under cold running water, and it stopped
Yeah,
bleeding after that. And I
that's
started
right. Yeah,
sterile dressing as well.
yeah, that's right. You did the good thing, and I will assure you that after I examine the wound, this wound is a small wound. We need only to clean the wound, and I will do closure for the wound, and I will do by absorbable suture, so we'll leave no scar or just a little scar that we can deal with it after that. Is that clear so far?
Yes, but I'm just worried. What about the infection? I heard that once you have a wound, the chances of
Yeah.
having infection is high. And, dog eats all those filthy things. I'm worried about
Yeah,
infection, doctor.
yeah, Miss Asha, I appreciate your concern, Miss Asha, and I can tell you that after you did the good first aid for the wound, and I will clean the wound and I will do appropriate closure of the wound. So this is a low risk of infection. We have no. This is a recent wound, and we managed early. Also the face has a good blood supply, so we will not fear of infection, and the wound will not leave, will not leave an ugly scar. But I need to check more with you. What is about his immunization?
Oh, yeah,
Did you? Yeah.
I think my daughter had a tetanus vaccination last year, so.
So yeah. So we are immune now, and this build more his immunity, and we have no risk of infection and no risk of tetanus. I can assure you, and this. I can tell you that I think no need for a booster dose of the immunization because he's still 5 years and he did his immunization already. So I can recommend you how to care for the wound and how to do dressing for the wound. And when we can remove the stitches, we can review the wound after 48 hours. Is that okay with you, Miss Asha?
No, I'm a bit worried about infection. Like, how about giving antibiotics? Because, once you have infection, you have to give me antibiotics. And
Yeah,
how can we recognize the sign of infection? What if there is infection?
Yeah, I understand you, Miss Asha. We classify the wounds as a categories. This wound is low category. We have low risk of infection. So antibiotics are not necessary. We'll give also only an analgesic for the wound, and we'll do appropriate wound dressing. After that, no need for antibiotic, except if there is any changes in the wound that I will tell you more about that. Is that okay for you, Miss Asha?
Yes, but I'm so frustrated. I came for vacation here and, I have no experience how to deal with these dogs. And, my friend told me that the dog is very, children friendly and they love the kids. And now I'm stuck here because the dog attacked my kid. It's so
Yeah, Miss Asha.
frustrating.
I appreciate your concern, Ms. Asha, and I can understand yours, but you need not to know that we need to do constant supervision of children near the dogs, not you.
Oh, yeah, I think so. I should also look after my child when there is a dog around. That's silly of me as well.
Yeah. As I said to you, Ms. Asha, as we have been so, you must supervise your child in the dogs, and this wound you cared already well for the wound, and I will do appropriate closure of the wound, and I will tell you how to deal with the wound after that, according to dressing, and I will review after 48 hours. No need for antibiotic, just analgesia. Your child is immune. I will follow up you after 2 days. Thank you. If you have any other queries, don't hesitate to contact me.
Thank you very much, doctor, for your concern and for your help. It has been a great help for me. Thank you very much, Dr.
Thank you.
Mustafa.
Thank you.
It's the time. How about the time?
About 6 minutes.
Oh, we already went ahead. Like, I didn't hear the time, so
I read
okay.
time, but maybe.
I didn't
Okay.
hear the ring.
So I think so far I think you did good, Dr. Mustafa. I think it was good comparatively. You tried to ask me. And also don't forget, you cannot say he for she. I'm talking about daughter. I'm not talking about son. So you have to make sure. You have to say
Okay.
she already has. Sometimes I've noticed you just say, oh, she into he. You cannot. That shows that how much you're attentive to the patient. You have to listen everything the patient says, and you cannot say her daughter into her son. So that's always be careful. You cannot just say, oh, she did like just. I think with practice you'll be okay. So far so good. You need to practice some more.
Okay. And about
Okay,
the robot, it is good now or still?
Yeah, it's good. Better than before. You are
Can
listening to me. You are listening to the patient.
Okay.
can I
I
ask
try to
Dr. Asha,
what about
about
Yes, doc. Yes,
what
doctor.
about Australia is free of rabies? Nobody mentioned this because it is mentioned in the card.
he said the first sentence.
I
So you said it?
assured the patient in the first sentence. Australia is free
Maybe,
of rabies. No, we
okay,
have no
maybe
rabies.
He,
maybe I didn't catch it. Okay, fine.
he didn't follow
I also didn't hear.
the
Thank
lines.
you, doctor. Because I'm focusing on my patient, so I don't see what's the candidate. But I'm sure he has to mention Australia is free, because I'm worried. Oh my God, what will happen? And say, don't worry, it's free of rabies. You can go
Yeah.
and bite again. Free of rabies. So we'll see again on 9th.
Okay,
Okay,
fine.
just one question about how may I address you.
Yes.
Is
How
it
may I?
different
Yes.
from what's your name? Yeah, what is
Yeah.
the difference
What?
between this
It's
question
more
and
polite. How may I address is very polite, because if I say, because here in UK it's you have to understand the patient's right, they are like king. You have to serve, like not serve, but because sometimes for example your name is Dr. Ahmad Ali, and I say may I have your name, but you don't like to be called Ahmad. You always like to be called Ali, but I say Ahmad, it may irritate you.
Mhm.
It happens because sometimes I like to be called Rana, or sometimes I like to be called Asha. But what if you keep on saying Rana? I say, why don't you call me Asha? I get irritated in the middle.
Mhm.
So you don't know what the
what?
patient wants.
So what also about Mr. or Miss or Mrs.
Oh, you
It is
can
more
say
polite to add or
no. For example, if I want you to call me Miss Asha, I'll say, how may I address you? Call me Miss Asha. I will say it.
if you said Asha, so I will follow
Call me Asha.
Asha without Miss or Mrs.
Yes.
or.
What if I get angry? You call me Miss again? I say Asha. You don't know what the patient wants. So whatever you say, if you say, for example, you said, you asked me, how may I call you? I said Asha, but you say Miss Asha. I said, why you are calling me Miss Asha? Just call me Asha. Patient can be. I mean, I'm giving the situation where patient may get irritated. Sometimes they just like to call them. If they want to be addressed like Mr. and Mr. Call me Mr. Ali. Call me Mr. Ahmad. They will say, okay, Mr. Ahmad. Okay, Mr. Ali. You'll say. It's their choice,
Okay.
One more
That's
question. What about hospital emergency department? I have to ask about the date of birth or no need
yes,
because it's
yes.
hospital.
In hospital, it's always remember, whenever you are saying hospital, always ask date of birth.
Okay. So I have to ask the patient or the attendant because it's 5 years and it is mother. So how can what can I ask? I told her, may I have your name and your
And date of birth. Yes, date of birth, please.
of the mother.
The mother.
That's what I'm asking because this is
Oh,
5.
okay. You mean to say this one? Yeah, you
Yeah.
can ask for the child.
So how can I say it? Because I am
Because
saying
I think it's not. May I have the name and the date of birth of the child? You can ask, but mostly because I'm talking about, this is the emergency, because it's not admitted also, but they
okay.
may have that thing. But mostly when we talk about the admission, like there was this one, where were we? I forgot that one. I got a bit confused because the patient was admitted. Here, this one, number 5. I have been admitted in the hospital with diverticulitis. This one needs to know my date of birth because you want to check if I'm the same patient.
Yeah, that's right. But it is emergency department, so we don't have to ask about date of birth, or we have.
I think it's if you are for the sake, I advise everyone to ask in everyone actually, but in clinic you don't need. So that's why in
Okay.
hospital always ask, always, just to be
Okay.
safe.
So this is for this specific. This is a child, and I'm talking to mother. So I ask, may I have your name? Then date of birth of the baby. How can take it the history from the history, because I will pass through this talk, and then I will tell her how can I help you. Then she will tell me my child is and she will say 5 year. It is already written 5 year, so no need to tell, isn't it?
No, yes, no need to tell. But
Okay.
it depends, because sometimes in the same hospital emergency room, it may have a different question scenario that really needs the date of birth.
Okay, fine.
You know,
fine.
sometimes that's why we need to use our brain which one needs something. But at the back of our mind, we should know that
Okay.
for hospital, we always check date of birth.
Okay, fine. Thank you.
You're welcome. So see you on the 9th, everyone. Thank you very much.
Inshallah. So
Thank
thank
you.
you very much. This session was very helpful. Thank you very much.
Yeah, we'll practice more. And always remember, always ask lots of questions to the patient. Always don't. Okay. Bye-bye. Good evening.
Bye.
Okay, thank you.
Bye.
Good evening.
Bye.
Good night.
Good night.
Good night.
Assign and okay. How do I